So welcome back. My name's Gwen. I'm an anaesthetist and pain specialist, and we're talking about chronic pain in dogs and cats. And this is the last section of the series. We're going to talk about chronic neuropathic pain using the case example that we've previously been using. Lucy comes back to you again. You've been managing Lucy since she was 6 years old, when she was first presented to you with bilateral elbow dysplasia. And she then injured her cruciate ligament in her left stifle when she was 9, and she had a TPLO surgery for that and made a really good recovery because you had some good treatment in place with physio and some hydrotherapy, and you supported her through all of that with some medication. Lucy's now 12. She weighs 30 kilos, a little bit less than she did last time when she presented. She's still got a body condition score of about 6 out of 9. Not bad. She could lose a bit of weight. But now she's slowing down more on walks, and the owner's brought her back to you because this is something she's really noticed as a problem. And the owner's also noticed that she's occasionally scuffing her hind feet. So it's important to think about the physiology, just a little recap of what's going on here. We talked in the first section about what is pain, about the process that happens during nociception. And when pain persists for hours, days, weeks, we get that sensitization of the dorsal horn of the spinal cord and potentially facilitation of pain that instead of an inhibition of pain at the dorsal horn. So the brainstem control of pain has gone more to a facilitatory scenario. And this is what we see with chronic pain. What have we got going on here? And I would go straight to thinking about, well, I would assess the whole animal, but I would start thinking about lumbar sacrum or hips. If this dog's slowing down, maybe back pain, things like this. So what we actually saw with Lucy was that when you examined her, she had specific pain over the lumbosacral joint as you pressed on the dorsal spinous processes. The hips seemed okay, quite a good range of movement in the hips, although she did resist you pulling back her hips a bit, probably because she's got chronic tightening of the muscles, the hip flexor muscle groups. And also when you extend the dog's back legs, you are also putting pressure through the lumbosacral spine. So it's important to distinguish. There was a whole talk given by two of our clinicians, Tom Harcourt-Brown and Darren Carradine, at a Langford Academy Day last year, when they talked about how to differentiate between hip dysplasia or hip osteoarthritis and lumbosacral pain. So I'm not going to go into details here, but let's assume that Lucy's got lumbosacral degenerative stenosis. And you do an x-ray, and this is what you see. On an x-ray, all you can see is the bony change. So you don't know if you've got nerve impingement or not. You'd have to do an MRI for that. Or possibly you might get some useful information from a CT scan. If you don't want to refer Lucy, and the owner is not keen to refer her because she doesn't want to go down a surgical route if there was one available. She doesn't want to go down to the expense of advanced imaging. So you take this x-ray, you see this change in her lumbosacral region. It's reasonable to assume that she's going to have some pain here. And we've got different types of pain going on with lumbosacral degenerative stenosis. We have, obviously everyone jumps to the nerve impingement potential, but we also have pain related to the nociceptors that are in the joints, the disc, and the meninges. There aren't actually nociceptors in the nerve roots themselves of the spinal nerves. And so we've got pain related to arthritis in this region that we can treat, obviously with other drugs that we normally treat, osteoarthritis with, but also she might have some neuropathic pain from nerve impingement. And the pathology of nerve impingement causing neuropathic pain is quite complex. I'm not going to go through that pathology here. But my point really is you potentially have a mixed pain type here. So just going back to our development of chronic pain, remember we talked about central nervous system changes where we see sprouting of new terminals, new excitatory receptors created and put into the membrane of the nerve, and we see loss of that inhibitory interneuron group and long-term potentiation and this pathological disconnected pain. So although we think we've got a particular pathology we're looking at here, we do have a disconnect between the amount of pain the dog experiences and the actual pathology. So even if you were to do surgery, for example, it's often successful, but not always. And that might be related to the fact that the pain is somewhat neuropathic and is difficult to actually get rid of once it's there. So what's our treatment plan? Again, we've got all these modalities. I think here it's really important to look at some physiotherapy for Lucy and maybe some acupuncture, keeping that weight down, restricting her exercise, making sure that we are protecting her from further injury in the household environment, and medication. So here I've scribbled down the medication she's already on is that anti-inflammatory, the paracetamol, and the NMDA receptor antagonist. But now I'm going to add in a gabapentinoid as well, because I think she has a neuropathic component to her pain. And remember that the owner reported she was scuffing her toes. Now that could be due to weakness, or it could be due to actually a neurological deficit, which obviously you're going to do a neuro exam to try and work out. That means that we've got the relevance here to think about introducing a gabapentinoid. However, one of the side effects of gabapentinoids is sedation, ataxia, and weakness. So if you have a dog that is quite elderly, quite weak, hasn't been going through physiotherapy, hasn't been keeping up at exercise levels into old age, and you introduce a gabapentinoid, you can quite often make the situation worse. So you need to be quite careful with how you introduce it. And I would always say start at a low dose for a few days and gradually build it up, because what you don't want is for the owner to say, whoa, my dog's really sedated, she's falling over, she's slipping, I can't have my dog on this medication. So you start at a low dose to try and avoid those side effects, and then you build the dose up quite quickly within a week or two to more like a therapeutic dose. And you're much more likely to have success with that. So treating your neuropathic pain without making the animal weaker. The other thing I do find with dogs on long-term gabapentinoids come to the pain clinic is quite often they've ended up on quite high doses, and it's making them weaker. It's making them appear worse, and they also are a little bit dull and depressed on it, and that's a side effect we know exists in humans. So just as a little aside note, going into the depths of my analgesia medication teaching, I often find that switching gabapentin to pregabalin can be really helpful in that situation, and I do that a lot. And as I said before, if you want specific advice about a case, please send in an advice request via our website or email me on the email address we have at the end. So I will be doing a separate talk on medications in the future, in due course. So watch this space, and we'll go into a bit more detail of where it's appropriate to use each medication. And I encourage you to, as I said, engage with me for advice if you want. I do also have a special interest group for chronic pain if you'd like to join that. And we discuss these things on a regular basis with like-minded vets who are interested in chronic pain, and also physios are in the group as well. So I'd encourage you to engage there, because I haven't got time in this talk to go into the medication in great detail. Here are my contact details. And also, if you go to our website, we have the advice request. There's an advice request form you can fill in. and that will come straight to me. And we can either have a telephone call, or I can I give you some advice by email, which is often easier than trying to get hold of you by telephone. So I hope you've enjoyed this series, and it's been informative. I'm sure it will have opened up many questions. So please email me if you'd like to discuss it further. Thank you.